Great. Well, good afternoon. Assalamu alaikum. Welcome to Defense Services Marketing Council's virtual working group. This is our virtual boardroom series where we are bringing together DSMC members and partners to share important topics. As we normally do in person, this is our chance to meet online and in our virtual community to keep the connections going and to encourage more dialogue around important events that are happening in our community. I want to remind you that during the online presentation that it will be recorded. The video and audio are being recorded so that others that are unable to make it today will be able to watch this online at a later date. Also, for questions that may come up, please raise your hand using the raise your hand feature or send a question in the chat. If we run out of time, we have been able in the past to follow up with your questions. Please either email them to myself or any member of DSMC team, and we will get your questions answered and sent back out to you, as well as a version of these slides. We would typically introduce ourselves at a virtual working group. Today, because of limited time, we will jump right into the topic. First, I'd like to thank Dr. Griffiths and Cleef University. Steve has agreed to talk about how Khalifa University can engage with your organization during and after COVID-19 crisis. And as a working group, we would like to encourage you to share your interests and how you would like to collaborate on future opportunities. With that, Steve, I'd like to turn it over to you, and we will run through the presentation.
Great. Thanks very much, Matthew, and thanks to everybody who's joining today. As Matthew said, I'm going to go through a discussion about how Cleef University can work with your organization during this challenging period we're facing of the COVID-19 crisis, both during the crisis that we're currently facing, and then if it soon, hopefully soon ends or comes close to being an end, how we can work throughout that stage. What I've done with the presentation today, Cleef University is doing many things around the coronavirus situation and our own operations and working with partners. As the SVP for Research and Development at Khalifa University, I'll talk mostly or almost entirely about what we're doing in the R&D in order to help the UE with this challenge that we face. So what I've done with the presentation is first to give you a brief overview of how we've structured R&D at KU, so you get a sense of the platforms we have to address the situation. And then I'll go through some of the specific areas that we're addressing and the projects we've undertaken with some of our partners. And then finally, we can have a discussion about your interests and how you might see a collaboration forming between your organization and Cleef University. So to start off, just one really quick high-level view of what Khalifa University looks like between R&D and academic. And as you can see, Cleef University is a premier, hopefully considered the premier college or university in the country around scientific research. We have 3 colleges where we have faculty that have expertise in a number of different topical areas. The College of Engineering, Arts and Sciences, and our most recent addition to the college is Medicine and Health Sciences. The colleges work very closely, of course, with the research arm of the university, which I oversee. The research arm has an administrative component with the typical services that we offer to support R&D, but importantly for bringing the strategic view to the university's research. There are a number of institutes and centers that we formed that faculty work in along with researchers and students, and those centers and institutes are developed around vertical and horizontal sectors, which we found to be the most important for the UE, and sectors that certainly are going to be very important and are being leveraged as we go through this challenge we're facing with the coronavirus. Within this context, the areas or the focus topics that we have for the verticals and horizontals for research, as you can see, the energy and water and environments are key topics along with hydrocarbons. This is what the country's been built upon, so we focus on that. You'll see quite a bit about how we're leveraging our healthcare vertical. This has been an important area for us for quite some time, even more so now given the coronavirus challenge we're facing. Aerospace and supply chain logistics are other 2 vertical areas we focus on. And our platforms are oriented around robotics, AI, data science, ICT, and advanced materials and manufacturing. So given that these are the strategic areas that we're developing in order to undertake the R&D, what we've done to operationalize the research at the university is we've created 3 research institutes and 20 centers, which you'll see very shortly, which allow the faculties and the researchers to work across these areas in a very integrated way. Now, I'm not going to go through all the institutes and centers, but it's good to be aware of what those are as we get into some of the projects related to COVID-19. As you can see in the water and the environment and the clean renewable energy area, those are under the Mausner Institute, which prior to a merger in 2017, which brought 3 universities together, had been a university of its own right, now is a research institute under KU. And so there we're doing lots of work in the energy space, and there's certainly important R&D being done, but not as much leveraged in the context of today's discussion as some of the other centers I'll talk about. Petroleum Institute, close partner to the National Oil Company, looking at hydrocarbons, exploration, production. Healthcare, you'll see a lot of references there when you see BTC, HEIC, our Biotech Center and Healthcare Engineering Innovation Center has been doing quite a bit around COVID-19. Our aerospace group, we have a new space technology center I won't talk about, but the ERIC Center, developed in collaboration with Strata, Aerospace Research Innovation Center, has been doing a lot of thinking about how we can bring manufacturing capabilities to battling COVID. And so we'll talk about that a bit. And then we have our supply chain logistics area, which is certainly an important topical domain for some of the challenges I think that we're going to be facing collectively in the future as COVID impacts multiple different sectors, particularly supply chains. On our horizontal platforms, we have a new institute as of 2019 July. This is the Artificial Intelligence Systems Institute. So there, besides the broad topics I talked about, we've embodied those or enabling those through centers which are focused on robotics itself, KU cars, cyber physical systems or IoT, and then system on chip, which is semiconductor hardware. We have a joint collaboration with Korea Smart Healthcare, which is very important now, and then smart transportation being worked on with them. This is KAIST. And then EBTIC, it's a joint collaboration with the British Telecom and ICT Fund. And KU, of course, is the home of the center. And then again, Eric representing another domain where it has relevance. And then in materials, we have Eric playing a key role, but also a center,
Steve,
another center.
We are getting some notes from some of the attendees that if you could switch to full view instead of presenter view, it would allow them to see your slides better.
Okay, all right, so let's see here. Not sure, it's in full view. I'm not sure why okay. I'm not sure what the,
okay.
I mean, I'm on full screen. I'm not sure what
let's proceed then. I think most people are able to see it, and we will get a copy of these slides to them afterwards.
Yeah, apologies. It is in full screen. I'm not sure I'm not sure what's popping up. But
sorry for the interruption, and let's please continue. Sorry.
Okay. No, I'll try and see if I go through here, see if there's a way to, and I thought that was, okay. So let's go on to, with that, let's go to the KU's COVID-19 response and leveraging, of course, the centers and the capabilities I talked about. So what we've done at Cleef University starting in April is the epidemic became a pandemic and then, of course, largely impacted the UE as every other country in the world now. We've created a task force in order to begin to look at this in a very close way, the research opportunities around COVID-19. And so we created a task force that would allow us to engage with external organizations that are looking at COVID-19 in the UAE from the government level and also the industry that's having a concern, would like to help address COVID-19. We have been looking at the communication strategy, working with the communications team on how we communicate our R&D efforts, and then launched a funding program on research that we find most relevant to helping battle the country's challenges here. And I'll talk about the topical areas that we're focusing on in the R&D. The task force has our faculty experts across arts and sciences, engineering, and medicine, as you've seen previously, as well as the directors of our centers in healthcare, and then our AI Intelligent Systems Institute senior directors. So all the different capabilities required to put together a very good response and research were assembled in the task force. We also, in parallel, we have joined, I don't know if you've heard about the XPRIZE Pandemic Alliance. We have become a member of the Pandemic Alliance. As you can see, they have university partners, corporate partners, and NGOs. Khalifa's in the bounding box, the purple bounding box you see on your screen. And the Alliance was formed to solve immediate challenges around COVID. As you can see, the things like personal protective equipment, which are in shortage in many countries, and providing security to food and medicine are just immediate challenges that all the organizations involved are trying to help address. On the short term, as we start to get a little bit further down the road toward getting out of the immediate crisis and bring some stability to COVID, there are a number of other challenges to try and help us deal with the potential for a second wave of the outbreak. Looking at point of care solutions, testing, of course, will always be important to trying to understand where COVID is, and then trying to help us get some of the proper social distancing in place so we can begin to resume our normal lives again. And then the medium to long term, there's a number of different topics which will most likely be relevant for the years to come. And so getting into looking at trying to bring care where needed and connecting people, such as the ways we're doing now, are going to be long-term challenges. And so we've joined the Pandemic Alliance so that we can work with a number of organizations to helping them think about these types of issues. And it's helped broaden our thinking about where the research should be happening and how we can be most beneficial to the country. We've worked with a number of organizations through the task force. If you're not familiar, the Ministry of Health and Prevention has a National Research Committee. And so we have a number of our own committee members on this task force, helping us to engage and make sure that we're aligned with the UE and its initiatives. Ministry of Interior, likewise, as you can imagine, has a number of different efforts that we're working with them on. The Ministry of Advanced Sciences, besides publicizing the efforts across the country, also has helped us establish a coronavirus host sequencing initiative, which we're undertaking. You'll see some more about that shortly. And likewise, Mubadala Healthcare and National Reference Lab have been involved with us in a similar type of initiative. Mubadala Healthcare and Saha, so you'll see about a patient tracking app that was launched fairly quickly, and we're now further developing. Lots of press, so I'll go a little more detail on ventilators. We've been developing emergency ventilators, developed with Tawaz Inside Military Hospital, and then modeling, epidemiological modeling with Saha, and then Etisalat, of course, there. Have lots of data that's quite useful for looking at spread and geolocation, and then Strata, which has been interesting, as mentioned previously, working on some of the manufacturing opportunities. And I'll go into some more detail what we're doing at the partners shortly. Before that, the R&D program that we launched specifically is we looked at areas that were most relevant for the UE: epidemiology, diagnostics, and medical devices, and then a suite of digital tools to understand the virus propagation through modeling, simulation, prediction, and then also with application to mitigation and resiliency. These are the areas in which we put together two different modes of funding. One is open call for good ideas, seeing what's out there amongst the faculty at the university, able to respond in these areas to the challenge. And then through the task force, we had leads in the different areas, each of the areas I've talked about here, and they put together their ideas with teams in a very directed way. And so we have the task force projects and the open call projects. You'll see what those look like. All the projects in general, they're intended to be of relevance this year. So it's a rather short cycle because we're trying to hit on a challenge which is right before us and have this near-term immediate impact. So they're starting from May 1st and ending by the end of this year with their initial results. The projects that we had, I'm not going to go into tremendous detail, but I'll give you a broad understanding of how we've been leveraging the previously noted centers and research domains we cover to address COVID. When you see a bolded abbreviation or acronym, that references one of the prior centers I mentioned. So BTC, Biotechnology Center, is doing a project from the open call around epidemiology, which touches on another project I'm going to see shortly related to genomics, but this case looking at how COVID could potentially cross between species, which we know is a very challenging and important area to consider if we're going to mitigate the spread of the virus or potential for even more harmful viruses, should we have some kind of combination with some other form of coronavirus, such as MERS, which we've seen previously in this, only recently actually in the region. Digital tools, so we have the Robotics Center, KU CARS, and that they've been looking at now a new project with LAN Hospital for self-sanitizing mobile robots. As you can imagine, you don't want doctors to be in the presence of people with coronavirus or other infectious disease. So a robot, it can help with this and self-sanitize itself, be quite useful, and we're exploring that. We're looking at different ways to do the diagnostics, and so the diagnostic project looking at trying to detect coronavirus directly from the RNA. Most of the detection approaches require reverse transcription of RNA to DNA and then amplifying the DNA to detect it. This is an attempt to not only get the virus's RNA and isolate that, but then directly detect using photonic means the RNA itself. Second approach is microfluidics to go with the classical DNA amplification detection, and so it's simply a more sensitive way with lower amounts of DNA required for detection. We're doing masks, so as you can imagine, personal protective equipment is quite important for us, but not all of the equipment is of the same comfort for the wearer, the same standards, so we're looking at technologies and approaches such as new membranes, which would allow us to, say, electrospinning to create fibers with different types of nanotechnologies, which are could be potentially be understood to be bactericidal, but hopes will also kill viruses, integrated with the masks. So that project is going forward, partnership with the University of Salerno, potentially having a manufacturing operation in the future locally. And then look at the social side, as you can imagine, workers in the hospitals, they're stressed tremendously when they have something like a pandemic that they're confronted with. And so looking at the psychological, immune system and cardiovascular impacts on workers, along with Zayed Military Hospital, is another project that we're now moving forward to fund. On the projects that were created from the task force themselves, with SAHA, we're looking at the epidemiology from the modeling perspective. You've probably seen online and in the news lots of epidemiological models, and when one needs to be created for the benefit of the UAE. And so we've been working on developing this, not just the model itself, but the data consolidation required to support that. The characterization of the virus, so DNA sequencing, I mentioned a prior project, looking at how the virus may go between species. Here we're looking at the virus itself and its variants from COVID patients, and then looking at the DNA of the genomic signature of the COVID patients and seeing how different genomes of the hosts and the patients that are infected interplay, so that what makes one person more susceptible to a severe case of COVID-19 than another is one of the important types of questions we're tackling. We've been looking at the digital tools. So the Places app is trying to identify the extent to which the virus may be spreading. And so you can use, for instance, call record data. If you have understanding of where the different individuals that are infected are, being able to see who else may have been exposed to the virus, and then to what extent, and then trying to figure out where there may be future outbreaks. Patients that are already infected and they're, say, in quarantine may have a progression of the disease, and being able to monitor not just what they would tell you, so there's some mobile input from survey type of data, but also from their respiration rates, heart rate, other types of vital signs that you can grab directly from cellular data or smartphone data today is being integrated into a platform to help track how patients are progressing through the COVID virus. And then the ventilator, as I mentioned, is a global shortage in ventilators. Those individuals that are severely affected by coronavirus sometimes need help with respiration, and so they will be put on a ventilator, and the shortage of ventilators has required a number of organizations to start creating from commercial off-the-shelf tools and components, new ventilators. And so this one, I'll go into a bit more detail. It's one of the first projects we did, and it's already progressed to have impact in getting tested out through Zayed Military Hospital.
Steve, just as a time check, we have roughly about 10 minutes left.
Sure. Almost done. I'm just going to take you quickly through because I want to get to a discussion. With the ventilator, so this is what it looks like. If you can see, I mean, it basically provides oxygen to a patient. There's the dummy on the table at Zayed Military Hospital demonstrating the proof of concept. There's a local partner which may be able to establish manufacturing. Nonetheless, even if that doesn't happen, the design has been submitted to the XPRIZE Pandemic Alliance. I mentioned previously, they have a Give a Breath challenge. Thought this was quite a potentially competitive idea to be able to build emergency ventilator systems, and so we've submitted this to them. It's progressing quite nicely. The mask, so with Strata, I think it's very interesting. As a manufacturer of aerostructures, you wouldn't necessarily imagine the direct engagement around COVID, but there are opportunities in manufacturing that allow many organizations to participate near term, medium term, or long term. The near term, creating new types of masks, whether it's going to be ones that are respirators essentially with filters at the bottom, or it's going to be a face shield where you can say 3D print the crown or the attachment for the visor. These are things we've been looking at, and here's some initial ideas generated from the team on additive manufacturing. Longer term, we're looking at future manufacturing, so contactless manufacturing. So right after we're over this immediate crisis and we can start to resume normal, quote, normal activities in the workplace, there still will be social distancing required, and there'll still be concern for the spread of the virus. And so how do you manufacture in such a situation? Types of ideas we're brainstorming. With that as a sort of a lead in to where discussion can go, I would say the way I've thought about the opportunity to work with organizations based on what we've done so far at KU is there's short-term, medium-term, and long-term ways to engage. On the short term, you've seen things like ventilators, face shields, and masks. You know, companies across the world, car manufacturers, and these types of organizations doing things like creating ventilators. They don't do this as their core business, but they're in an emergency situation. They have engineering skills they can bring to bear, and so they engage in these immediate needs for society. And so this is the types of work that we're doing with some organizations, and I've given a couple examples of those. On the medium term, you know, right when we get maybe a few months hence from now, maybe the summer, it might be the fall, there will be a new normal. It won't be the way things were exactly before COVID hit the region. And so there will be changes in work practices, customer needs, and supply chain operations. And how do you go about thinking of the technologies required to address these new normal ways of working? How do you address the types of practices in the workplace you'll have to be undertaking? And so that's a whole level of thought that we've now, as you've seen just from a few discussion points previously, we're looking at with local organizations. I think many organizations would be a good partner for us to look at this. Then there's the long term, which would be the next normal, which we don't really know what that will be. We know there'll be an emergence from crisis, but then once we get to the other side in a more comfortable way, what will industries and sectors look like in the coming decades? I think that's an extraordinarily interesting way to think about the development of new technology. There will be an acceleration of digitalization for sure. Virtual and augmented reality, who knows what will happen with international travel, but these could be great means to have engagements when you don't have to physically travel somewhere. And in manufacturing, again, I mean, I think the entire way in which we look at it will be transformed in many ways. And the lights out factory may come sooner rather than later, depending on how easy it is to bring your workforces back into the factory floor and work together as they once had. So I think these are the ways we look at it. I'm quite interested in hearing perspectives on how we may work together, and I would certainly offer anyone in attendance today, if you have an interesting idea and you have the desire to work with us, I myself would be happy to receive your interest and try to make a connection as appropriate.
Steve, amazing presentation, and really the team that you've put together in such a short time and reflects in these various efforts is phenomenal. We have a few minutes for questions. I've been receiving questions here directly. Let me ask you the first one. The question is, if we are working with Tuazun and offsets, should we put together a concept paper for Tuazun around the COVID response, or shall we bring it to you first?
I think it'd be good to bring it to us. I mean, that'd be good. I mean, I ultimately, to the extent to which any of these organizations are interested in engaging, it's up to them. And so I'm giving you some examples of how we've done collaborations. But I think it would be good to, certainly go through the academic route where this is our job, it's our accountability to partner and collaborate. And then if there is opportunity beyond that, I think that can be discussed with the organizations that be partners at the appropriate time.
Excellent. The next question that we've received is about the human and animal transmission. The question is there a unique aspect to this given the camel population in the UAE?
Yes, I think absolutely. And so that's one of the issues that are being looked at. I mean, we know those that mentioned the camels are familiar with MERS, and we don't really know that much about the details of how these different coronaviruses jump between species. And so that the one project I showed you previously is exactly looking at how the virus itself is able to propagate in different hosts. And so I think it's a good question. I don't know the answer myself, but that's one of the issues that's being tackled through the research.
We have time for one more question. The question is about your last slide, the short-term, medium-term, and long-term, and how large organizations can help to bring their resources to bear. I think the question is really around what do you need now? What is it that you're looking for? What are your highest priorities of engagement from organizations, whether large or small, within the defense, space, and security community that you need and that we can get you quickly?
Well, if you're trying to look across those three different time frames in which there can be engagement, I'd say that in the immediate term, anything that can be done to help solve the challenge of the coronavirus and bring support the UAE's efforts. I mean, those are just value added because there is the need to solve challenges which confront us today.
Thank you very much, Steve. I'd like to thank you as we have less than a minute left, but to thank you, thank Cleef University. We will get this video out and the slides and encourage people to contact you directly. Again, thank you to DSMC members and partners. Stay safe, stay well, and stay strong. Talk to you soon. Thank you.